We'll go ahead and get started then. Hi, my name is Jim Fenton. I'm one of the pulmonologists at National Jewish. I work at Swedish and one of the directors of our lung cancer program at Swedish and involved with lung cancer screening and the workup for cancer care and at Swedish. So I'm glad to be here. I'm one of the co-chairs of the Lung Cancer Task Force, and we'll move. So we have couple other co-chairs, Debbie Dyer and Tim Kennedy. Debbie?
Sure. So I'm Debbie Dyer, and I am a task force co-chair, I think, by default. I used to be a task force co-chair, and then I got more involved with the Cancer Coalition on the steering committee, and am now past chair of the Cancer Coalition, but I have to admit that a lot of my interest is in lung cancer, so I'm working with our task force co-chairs. I am a radiologist at National Jewish Health.
And I'm Tim Kennedy. I'm a retired pulmonologist who did a fair amount of research in early detection and early biology of lung cancer, and excited about our efforts to increase lung cancer screening in the state.
Thanks, Tim.
Hi, everyone. My name is Morgan Mortazavi. I am a contractor for the National Cancer Institute. I specifically work in the cancer therapy and evaluation program. And within that, I also am focused in thoracic malignancies. So I'm really looking at thoracic malignancies at the clinical trial level, looking at new potential clinical trials for lung cancer. I'm also the protocol manager for 2 NCI trials, the Alchemist trial, as well as the NCI NRG ALK master protocol. And I'm a co-chair of the Lung Cancer Task Force as well. Thanks for having us.
Thank you, Morgan. I think that I can speak for Tim and Debbie that I don't think the task force could survive without Morgan. She has been unbelievably helpful. And not only that, a newlywed. So we appreciate all of Morgan's work, even in at this time, difficult fun time for her in her life, a busy time, I should say. So.
Oh, thank you so much, everyone. I appreciate that.
Yeah. Well, great. Well, we just the meet and greet here for the Lung Cancer Task Force, and we've been pretty active. Let's see, probably started with Debbie maybe 5 years ago, I guess, as a lung cancer task force of the Colorado Cancer Coalition with Jim Jett, and yeah, probably about that long, maybe a little longer than that.
It's been a little longer, I think about 2013, because it was right after the U.S. Preventative Services Task Force recommendations came out.
And, like a lot of the goals for the other task force, I mean, our goal is basically just to decrease the impact of cancer, particularly lung cancer in the state of Colorado. And you can do that in a number of different ways. In 2016, we looked at trying to increase the tax revenue for tobacco. That ultimately failed, but then the Proposition EE passed here just recently. So maybe there was some groundwork led at that point. So hopefully we'd like to think that. But as Debbie said, the screening recommendations came out in 2013, were officially adopted in 2015 for lung cancer. And we really have some of the best data in all of the cancer lines for cancer screening, for lung cancer screening, yet the uptake for lung cancer screening is very, very low. In Colorado, the best state in the country is Massachusetts, and they're only screening about 11% of their patients. In Colorado, we screen 2.5% of our eligible high-risk patients. So the goal of our task force was to try to increase lung cancer. One of the main goals was to increase lung cancer screening in the state. And we need help doing that. So we would ask that anybody that's interested in lung cancer, and particularly in lung cancer screening, to help us out. So why join the task force? Well, not just clinicians, but any individuals that are involved with lung cancer care. If they want to use a little bit of data-driven strategies and have a little bit of energy, please help us out to decrease the lung cancer burden in Colorado, and particularly increase lung cancer screening. You know, we try to be very collaborative. We've involved public health folks from all over. We have part of our task force, some industry. We have all sorts of, you have nurse navigators, we have patients and patient advocates. So we have, we're very fortunate to have a broad group of people that are interested in lung cancer and helping us out. So we feel very fortunate to that, and we appreciate everybody's interest and help in this endeavor. So let's go into the next slide here. Some of the things that we've been working on are in the last number of years. We've been pleased to be right in the middle, almost at the end of our Learning Collaborative on lung cancer screening. This was an idea by Dr. Dyer to try to get everybody together. It started out as an in-person seminar, and I think we were going to do it, I believe, in the first part of May. But of course that got derailed by COVID, and but nevertheless, we were able to set up a virtual online learning collaborative focused on lung cancer screening. And if hopefully some of you have been a part of that, I think it's been a great series of seminars or some series of lectures. We're doing that every Friday. We did it every Friday in October, and then we have a couple more left. One of these sessions is with Jamie Stutz at noon here today. So that took a while. That took a lot of collaboration to get that off the ground, but I think it's been an excellent seminar, an excellent series that's come out of our lung cancer task force. We've had up to 600 registrants and really 200 or 300 active participants the whole time, all over the United States, not just in Colorado. So I think that's a thank you to everybody that's worked on that, particularly Debbie and Morgan and the ACR and the Colorado Cancer Coalition, Becky and Christy and all, so Allie. That's please stay tuned for Jamie's presentation at noon. One of the other things that we were working on also was the Civic Report. That's been something that I have been working on as well as the other members. And what we wanted to know was what is the actual, kind of take the temperature of what is going on with lung cancer screening in the state of Colorado. And one of the ways we were able to do that is access an all-payer claims database. This database is information that's readily available with a little bit of grant money, a little bit of fees that we need, but certainly readily available to query the database using codes for lung cancer screening and shared decision making. And so those codes then can be pulled, compiled, and they give us an information on the patients, not private information, but information on who's getting the scans done, where they're getting them done, who's ordering them, our shared decision-making visits performed. And all that data was recently compiled and presented at the Learning Collaborative earlier in October. So that is available, that information on lung cancer screening is available, but that information, that database is actually available for other task forces to use to help zero their efforts, particularly screening efforts. Other things that we've been working on include just broadening our membership. We want to include more providers, but also more areas of interest, including actual cancer care and surgeons and others. But most important, I think, is especially for the screening, is just to engage as many primary care physicians as possible, so that they can help educate and promote lung cancer screening in their environment, because they're really on the front lines and are super important in lung cancer screening. Some of the Debbie and some of the other members work more with the Cancer Caucus and some legislation. So one of the other things we tend to work on is kind of following some of the legislation. As I mentioned, we worked on some of the tobacco things, but more recently, the U.S. Preventative Services Task Force came out with new guidelines with lung cancer screening, and it was up. So what happens is they go through a review period, and comment period is open for those to write letters to support that. So we put together our own recommendations. For lung cancer screening, it was hard to believe that the grade came out as A, but we were or B, I'm sorry, the grade came out as a grade B recommendation. That's still covered by CMS, but we were hoping and wrote a letter to the U.S. Preventative Services Task Force during this comment period to hopefully increase that to a grade A. So those are the things we've been kind of working on in the last year or two, really, and hope to have help from everybody. So I'm going to go on to a couple other slides. What else do we have? Our goals. Well, the goals were really pretty much achieved. This first one, it was the Learning Collaborative, and just getting everybody together to work on lung cancer screening, particularly. By next year, we hope to have another data refresh, or really an annual data refresh on our Civic data, the all-payer claims database data. And then next year, we'll be looking at doing some more involvement with our legislature in the Cancer Caucus. So those are some of the upcoming projects for that. Debbie, Tim, comments on that, and other ideas, other comments?
Well, one comment is that we are looking at the obstacles, given how low the uptake is in screening, and one obstacle that is administrative in a sense is the need for pre-authorization by Medicaid, and that's just seems to us first of all, it's not as if there's an excessive number of tests ordered. And secondly, it's just a burden on PCPs that is a bit too far. I mean, we don't have pre-authorization for mammograms or colonoscopies. Maybe we have them for colonoscopies. Somebody can straighten me out on that, but or PSAs, and we really need to get that out of the way. Because the Medicaid population is such an important one for screening.
Absolutely. Lung cancer they're disproportionately affected by lung cancer. And just to clarify, so Medicaid, there's a number of states in the country that Medicaid does not cover lung cancer screening. Fortunately, in Colorado, Medicaid covers it, but there is that pre-authorization, like Dr. Kennedy mentioned, and we're hoping that we can, it's just one more hurdle that we have to overcome, or the ordering physician has to overcome. So hopefully we can address that this next year. So that's going to be one of the focus. Yeah, thanks, Tim.
And I just want to reiterate, like Tim said, we certainly as a group have become very well aware of the barriers and the challenges related to lung cancer screening. And I think we know this has to be a team effort of trying to address these things. And a lot of it is payer related. A lot of it is requirements set up by Medicare to be ordered in order to even refer a patient for lung cancer screening. Shared decision making is required. We're not against shared decision making, but it is a barrier if it's one of the few screening tests where that is absolutely required then by Medicare for reimbursement. So I think we're looking at just strategies and getting all of our heads together to continue to address some of the barriers. And we clearly have a lot of work to do. So we're welcoming all kinds of creative minds and thinking out there that can help us in that regard. The other area that we know that we have a concern about is in Colorado with radon, and that we have higher exposures to radon in Colorado than in other places. And so we are probably in the process of, well, we have decided to form a small subcommittee to address radon. And right now it's not really one of the criteria for lung cancer screening, but we know it's a risk factor. So we are going to be also digging into that a little more. So I think there are lots of issues for us to address, and we welcome all thoughts and input.
Yeah, and the access to care and maybe disparities of access, particularly in rural parts of the state. We're fortunate to have a number of members of the task force from other parts of the state of Colorado. So we're encouraging everybody all over the state of Colorado to help us out and get involved. So yeah, because there's scanners all over the state, but just getting there and access and having those patients be a part of a multidisciplinary team, and it's not always as easy as you might think, and so we do need help, especially in the rural areas. Great. So we meet once a month, every Tuesday, or the third Tuesday of the month, 5:30. And we used to meet somewhat in person, but I guess that's not happening. No, we've been meeting by Zoom for the last 6 months. So, and it's worked out pretty well, actually. And probably it helps attendance. I think we've had more participation. So in general, I think that's been good.
And anybody who might want to get involved, you can just send your info to that email, lung@coloradocancercoalition.org, or to Morgan, who Jim acknowledged keeps us all organized. There's Morgan's email, and we'd love to have additional folks working with us. Any other questions out there?
Other people in the audience that have questions for us? That's what we're kind of here for.
Yeah, this is your chance, if you're not on the task force, to ask questions of the chairs and see if there's ways that you can engage.
We promise not to make you work every day and every night on the task force, but we if you're interested, we would appreciate your help. So good. Well, if you're interested, please let us know. You can contact any of us directly or through the Cancer Coalition, or Morgan is really our go-to person. So her email is listed here on the slide.
Morgan, I see you got married and you also went to medical school according to this slide. So you have been busy.
Yeah, I didn't know that it was possible to get an MD in 2 weeks. But I just want to clarify to everyone, I just have an MS, not an MD. Those are, one letter can make a huge difference, you know. But
clearly just a typo, but just a little bit of humor in there with your busy schedule.
No, absolutely, absolutely. I just wanted to follow up and thank you, Jim and Debbie and Tim, for presenting these slides. I agree wholeheartedly with everything. I'm seeing a couple of questions about best way to get involved. Just pitch me an email and just feel free to express your interest. And I like to do a meet and greet with new members as well, just to figure out what their backgrounds are and what their time commitment could potentially be. So I'd be happy to speak to anyone who's interested in joining. I believe also on the Colorado Cancer Coalition website, there is a subscription link that you can click on to get on our distro list, and that I maintain that as well. So if you sign up in that respect, I can reach out to you that way, and you can get invites for our meetings and have all the information so that you can attend.
And I do see that there's a question about screening and monitoring related to surveying radon. I'm not sure if I'm exactly understanding the question, but right now radon exposure is not one of the eligibility criteria for lung cancer CT screening. But we certainly know that radon mitigation is incredibly important, and particularly in Colorado. And so part of the reason we wanted to establish that subcommittee was to see what we might be able to do to support those efforts.
Yeah, I think admittedly, our focus has been more on lung cancer screening, CT screening, but I think that that's a good reminder that we can certainly, we want to branch out and to have more help on the radon. And that's one of the reasons we're doing the subcommittee for radon. So if you're interested in that particular area, that would be great.
I'm curious, I apologize, I joined late, I was having trouble signing in, and then unfortunately we just lost a neighbor. So I'm a little distracted, but I'm curious, do you guys need help? Like, are you functioning in the advocacy world at all around lung cancer screening, or is there an advocacy component, or are we leaving that to other parts of the coalition?
So on a state level or national level?
Either, I guess.
Yeah. Okay, well, certainly on a state level, we have been very involved in, as Jim mentioned early on, which you probably didn't get to hear this part, we were very involved in 2016 with a tobacco tax initiative that came from the grassroots, from us and other stakeholders. And that did not pass in 2016, but as you may know, Prop EE did pass this past week, and there will be a tobacco tax increase, and there'll be a new tax on vaping. And so we are certainly working in that arena, and we want to certainly help educate folks about smoking cessation and other areas of tobacco or vaping control. So we've been involved in that level. And then we have connections certainly with the Cancer Caucus, and we would be delighted to pursue some initiatives there if we think there might be some avenue to maybe reduce some of the barriers to lung cancer screening through the Cancer Caucus and working with our state legislature. And on a national level, several of us are involved. Jamie Stutz, who you're going to hear from shortly, Jim and others of us are involved with the National Lung Cancer Roundtable. And so we are working on some advocacy issues there, and also through the American College of Radiology. So if you have an interest in advocacy issues, and certainly we are very close with the ACS and they do lots of things in that regard as well, let us know, because we would love to have your help on that.
Thank you, Debbie. And I'm unfortunately gonna have to cut us off since we're having this Zoom glitch issue today with how the meeting was all set up. So we are gonna have to end